this is my final time to do this sterile wound dressing change because I've done it so many times now. I'm gonna get it right. So, first off, my patient is going to have their gauze in place. I'm not redoing this video. They're gonna have their dirty dressing on their wound. I'm gonna walk in, I'm gonna identify my patient with 2 identification barriers, their name, their wristband. I'm going to wash my hands and put on my clean gloves because we're going to first remove the old dressing and we don't need to be sterile for this part. So we're gonna put on my clean gloves. We're gonna remove the old dressing, assess the site so that we can document after we do our sterile dressing change. We're gonna throw the old gauze away. Now we're going to take our sterile dressing wound kit. We're going to open this away from us. We're going to take our sterile field, only touching the outer edges. Since we are only clean, we can't touch the inside. We're going to lay this flat, making sure that we're still only touching the outer edges. So now we're going to take the rest of our kit. We're going to take our gloves and move them to the side, and then we're going to open the rest of our sterile field, or gently put the rest onto the sterile field, not touching any of it. We're going to take our normal saline and put it into the tray so that we can use it when we're ready to irrigate. But when we do this, we're going to remove the cap and place the cap with the head down, and we could pour out the initial first little bit so that that would just maintain sterility with everything. Okay, so then we're going to take off our gloves, wash our hands, pretending that our trash can was real and that was all disposed of, and then we're going to get ready to put on our sterile gloves after we wash our hands. So we can touch all of this. Okay. So we're going to take the inside part of the glove, making sure that we don't touch the outer edges of it, to put it on our hands since we don't have our sterile glove on our other hand yet. Now that we're sterile, we can touch this glove with whatever. So we're going to touch the glove and put our hand inside the glove. Okay. So now that we're sterile, we can touch anything that is inside our sterile field. So first we're going to take one of our Q-tips and put it in the normal saline, and then we're going to move in one direction. We're just going to do one clean sweep on the outer edge of our wound. We're going to take our dirty Q-tip and dispose of it. We're going to take our next Q-tip and we're going to put more in the normal saline, and then we're going to also do the outer edge of the wound, only doing one swipe every time. We don't want to do it multiple times, just once down. Then we're going to take our last one, dip it in the normal saline, and do one down the middle. If the wound was, had a lot of drainage, we could do more if we needed to, but this wound looks pretty good, so we only have to do one for each. Now we're going to take our clean gauze, our sterile gauze, and we're going to put it over the wound. We're going to take our adhesive bandage, and we're going to undo it and pretend, but we're going to undo it and place it over the wound side to cover the wound.